Hi, this is Roger Green, host of the Surfing the MASH Tsunami podcast. This week, we're offering 5 conversations from episode 4, our review of MASLD epidemiology and disease burden with Zobair Younossi, plus from the Vault, an epidemiology discussion from back in 2022. This conversation focuses largely on the work of the Global NASH Council, an organization of over 200 stakeholders in more than 50 countries dedicated to addressing the range of macro issues in the MASLD space. Zobair Younossi starts by discussing a project on how to implement guidelines for different specialties across regions. One goal is to align the 10% of the various guidelines that are different from others with those in other countries and to understand the reasons for differences. The second is to improve implementation, since unimplemented guidelines do no good at all. He goes on to discuss other Global NASH Council projects ranging from shared biopsies to the previously mentioned modeling activities. I asked Zobair to put this all in context of his earlier comments about high SDI versus low SDI countries. He describes differences in what food insecurity means between the two types of countries and how that should affect each country's pursuit of policy and guidelines. He also suggests it will be more important to provide patient and provider information for specific low SDI markets. Zobair Younossi has spent decades building a knowledge base that is a significant part of how the world looks at MASLD patient dynamics and trends today. This discussion encapsulates some of that wisdom in the context of Winter 2024. It intrigues while it educates. So just sit back, listen, enjoy, learn. And when you're done, join our dialogue in the LinkedIn discussion group.
Zobair Younossi.
There is a section for it. This takes me back to, the Global NASH Council that I've been chairing, and Jorn and 200 other members from 50 countries are members. We have taken on this really monumental project of trying to help implement guidelines across specialties, across different parts of the world. So the project here was for 2 reasons. One, when you look at guidelines, there's some differences. Maybe 90% of the guidelines are the same, but 10% are different. And you don't know whether these differences are based on regional realities. For example, an NIT may not be available in some part of the world. Or is it really just different assessment of the same evidence? So one purpose is to find those differences and see which one is actually true difference that we can come into consensus through a Delphi process, or they're just regional realities. And the second reason for this project was that it's great to have guidelines, but if nobody's following them because they're not being implemented, then it's all for naught. So what we're hoping to do is to put all guidelines. I think the last count we have over 100 some guidelines from across the globe that we have put together, and the team of Global NASH Council is going through this with the 7 committees that we have to address each one of these and then summarize these in a easy to access sort of way for everyone, so that we can have the original guidelines available for people in a library that people can download, or these easy to access sort of algorithms, figures, tables that came from the consensus process that people can just print out or access and utilize. And we'll make that available in multiple different languages. That's a part of the effort of the Global NASH Council that we have. Roger, you asked me to talk about other things in Global NASH Council. So this is one project that is a large project. Just for the listeners who are not familiar with the Global NASH Council, this is a network of collaborators across the globe. We started with a few 10 years ago, and now, as I mentioned, there are 50 members, the 50 countries with 200 members, and it's increasing. And now it's gotten endorsed by very prestigious societies, including EASL, ALE, as well as a number of other country-specific sort of societies and patient societies or organizations like American Liver Foundation. The project of guidelines assessment and implementation is one. We have another one which has to do with the cost of inaction, which is what Jorn talked about. 8 countries to be assessed in terms of economic burden that's ongoing. We have what's called a mega-analysis of liver biopsies. This is, I think in the last count, we have about 40 different PIs came together to share their data, de-identified data of liver biopsies and clinical data, so we can look at performance of NITs across the globe. We have another global survey of NITs, non-invasive test thresholds, and how they're being used in clinical practice. That a number of our colleagues, including Laurent Castera, Alina Allen, Jeff Lazarus, are a part of that study. So this is in addition to other projects that are run by the 7th committee of Global NASH Council that we have undertaken, and it's really very rewarding rewarding to see that a lot of these efforts will make a difference in terms of promoting awareness about this disease and generating evidence, not only at the local institution level or country-specific level, but then globally. But this is a global disease. This is not a single part of the world is spared. One of the things we want to do is to get more engagement from our colleagues in Africa, the continent of Africa, and also in Latin America, because in the meta-analysis process, we found that there's not a lot of data from these countries. So Global NASH Council has increased the number of membership from those areas so that we can actually give you a better idea about where's the hotbed of this disease and how local and global policies can make a difference.
Roger Green.
So in that context, Zobair, you commented earlier about the differences between conditions in high SDI and low SDI countries. Could you elaborate on that a little bit for our audience? We've got listeners in kind of all over the globe in all kinds of countries. Can you elaborate a little bit on the differences so people can understand how their situation might be different from, say, what they read in other places?
So it's really interesting because when you look at high SDI countries, it's basically access to quote unquote bad nutrition, meaning that, very high calorie, low quality foods that are available in these countries that promote fatty liver disease. And low activity also is the driver of MASLD in the high SDI countries. And the low SDI countries, it's actually when you are dealing with food insecurity, meaning that you're actually in those countries, food insecurity is not about quality of food. It's about what you have available. It's about poverty and malnourishment. It's a different story in those countries. So when you're developing policies to address these two different aspects of MASLD in different regions of the world, you have to look at how to create better lifestyle in terms of nutrition and activities in high SDI countries and low SDI countries. It's really providing food, because a lot of those countries, it's the poverty and malnourishment that actually is driving those things. Now, in addition to this, of course, there are other things that plays a role, exposure to what's actually in the environment in terms of potential toxins that can drive gut microbiota and other things that could contribute. And so it would be really important, pollution, for example. Pollution is an important driver of diabetes that has been ignored. And actually, there are studies that our colleague Shira Zeversagi has been at least teaching us about, that pollution and even the use of for example, single-use plastic bottles can actually promote these diseases. These types of education could be focused on, targeted for high SDI countries, but maybe a slightly different approach would be for low SDI countries. Part of the Global NASH Council's effort would be to develop these patient and provider information that will be on our website. So we are creating this for lifestyle. What do you do for adults in terms of what diets do you recommend? What type of activities do you recommend? And what do you do for children? Because that's really what's the tsunami is coming. It's coming from the kids because the prevalence is high and it's promoting this.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please put those in the review section of the page from which you downloaded this conversation, or send an email to me, questions@surfingmash.com. We'll be back next week to discuss what new information or product to expect in NIT space in 2024. Until then, stay safe, surf on. We'll see you on the podcast. Bye-bye now.